Hey, everybody. We're with Dr. Gregory Flynn, our newest family member at the Jasper Spine Institute. He and I are going to do a show today. Dr. Jasper is on sabbatical,
Yeah,
maybe?
yeah, well needed holiday.
Yeah, they all needed a
Yeah,
holiday. Yeah.
it's working too hard.
Yeah.
Good morning, good morning. Hi, I'm Dr. Greg Flynn. Happy to meet you today. Again, it's a live call-in talk show, so please use the number and call in and ask us any question you may have, hopefully about pain medicine. That's
Yeah.
our expert of the field, so I'd like to talk about that. But today we're going to discuss many topics, mostly dealing with your back pain, neck pain, joint pain, and how we deal with things interventionally, minimally invasive, which means we make tiny incisions, if any incision at all. And if we do make incisions, it's probably no bigger than the tip of my thumb. So that's
Yeah.
how we do it.
Yeah.
I would say that's how we roll.
Yeah, we got the number on the screen right now for those of you who are watching us live. We do our shows Saturday mornings from 10 to 11, and so that's a great time. If you like and subscribe to our channels, that's YouTube and Facebook, you'll get notifications for when we go live, and you can check us out. My head's cut off. Yeah, there we go. And you can have questions for the madman here, Dr. Gregory Flynn or Dr. Jasper. So here we go.
Yeah, our field of expertise goes way back. Dr. Jasper and I both started in surgery. He did surgical training and then went anesthesia, and I did emergency medicine training first while in the Navy. Was board certified in that field of medicine. And that was exciting. I was young. I was able to travel, work for different companies out of California throughout the southern states. It was a great experience doing emergency medicine, but I really kind of missed doing more patient care that's more continuous. So in anesthesia, which I liked a lot, was very short lived because again, you're not really doing long term patient care. It's just, you treat them, you get them better, put them to sleep, wake them up, and they forget who you are.
You say treat them and street them?
In the ER, we call it treat them and street them.
That's
Which means
great.
you get them. Hopefully, that's for the patient to come to the ER. That's what they want, to get back home and get out of that situation. This is a major trauma, being mid the hospital, something's going on. But it's a wide variety. ER is a very wide variety from P's, OB,
Yeah.
trauma, medicine. And anesthesia kind of covers the same category. So we're doing a wide variety of things. Anesthesia, we're doing hospital-based anesthesia. But now in interventional pain medicine, we kind of narrow our scope down and become experts in the field. And our patients become our patients for a long time because as you all get older, pains develop. No choice about that. We're going to have pain.
Our man Big D is in the chat. Good morning, he says. Good morning, Big D.
Good morning.
Yeah.
Give us a shout.
Any questions, Big D? Really test this man in front of me. Test him. See, let's test his metal today, huh?
Love being tested. Dr. Jasper did all the time when clinic working together, doing things in the OR. So I met Dr. Jasper back in 2011 when I saw him present at a conference in Orlando, Florida, by the American Society of Interventional Pain Physicians. And he was a presenter on a topic of endoscopic spine surgery. And at that time, prior to that, I had meddled in surgery in spine using scopes, using lasers, through tiny catheters, but nothing as successful as Dr. Jasper was doing with the spinal endoscopy. And I saw that, I just was totally amazed. So I immediately contacted him and got trained by him and ended that in my practice down in Tampa, Florida, which was an amazing experience for myself and my patients. We were actually getting people better, doing things the easy way for the patient, which means a tiny, tiny incision, maybe the size of my fingernail. And through the incision, we put a scope, and we can go in and we can retrieve things such as like this here, herniated disc.
Right.
It was end of the nerve root of foramen. Usually they would go before, open the back of the spine up here, cut it open, and either put a tube down there after doing laminotomy or cut the lamina away and take it out. But then we just go there with a scope, follow the needle down, put a scope in there, and pull it out, and we're done. And the relief on our patients is immediate because our patients, we do the surgery, they are actually awake. They're sedated, so they're in a dream state. But if I don't talk to them and shake them, and I talk to them and say, hey, what do you feel? They'll tell me right off the bat.
Like a twilight, yeah.
Very like twilight sleep.
And you got a good anesthesiologist. They'll pull the patient out just to answer questions, put them back under to forget the rest.
The medication lasts so that if you stimulate the brain with like say the name or something, they'll wake up. Otherwise, they're probably in a dream state, dreaming about something happy. We just give them happy thoughts.
First time I had an endo with Gabe, I didn't remember a thing, and he told me you were awake the whole time. No, I was filming somebody. I was filming a procedure, and I was like, "She's awake." And he's like, "Yeah, you were too." And I was like,
I remember it.
yeah.
It's funny because going from a student to a trainer to then back to becoming a patient of Dr. Jasper's, I had a back surgery in 2000 before I knew any of these things. I had a tubular discectomy, which is minimally invasive surgery, but nevertheless, your spine starts to erode over time. It collapses, the disc collapses, the foramina, which is again is a famous thing where the nerves exit here
Right.
at the side of the spine, that gets crunched together. So you had to open that up. So he opened mine up for me at L4 and L5 bilaterally. And all I remember was being asked to roll over on the table to the second side. That's for some reason that sticks in my mind. I went back to sleep. So it was pretty interesting, but it worked out great. I had relief immediately from it, and it lasted for quite a while.
That saved my life. That
Yeah.
procedure.
Yeah.
Oh yeah.
You know, and we don't just jump into doing spinal endoscopy. Everything's a stepwise process. We're very slow. Dr. Jasper's practice is very methodical, very pragmatic, and super amount of integrity. I see him do things for patients, but patients want more done. He says, "No, you don't need it."
Yeah.
Patient, well, I want the implant. I want this. I want that. I said, "No, you just do one step at a time. If you get 6 months relief from a simple transforaminal, which means through the side injection, and the pain goes away, that's adequate. You don't need to have major surgery done because that's good enough.
Yeah.
Come back 6 months more and do it again."
And for the let's see who we got here. That Big D again. Oh yeah. He says anything like a Minuteman for S1.
Big D. Unfortunately, the way God created most of our anatomies, the Minuteman has to go between the spine process, the back portion of your spine. So I'll hold up for people to see, and I'll explain for those who can't see. You have these bones on the top side of your spine here. And when they're compressed together like this, very tight, the Minuteman go between there and spread it open, and spreading the back of the spine process open along the top of the top bone called the lamina. It also opens up the neuroforamina, and there's a ligament in there called the longitudinal ligament, which actually becomes like the description we use is a leather belt, where you put a belt together, just snap it shut, makes a sound. That's a tight belt. That's if you're in like a sitting position or bent forward, the belt is tight. When it's pushed together, standing upright, it pushes down on the spinal cord nerves and causes an issue and causes pain. So we try to get the belt to be tight by taking out it's part of the ligaments and part of the stretching it out with the simplicity.
Well, that's what makes you feel like this irresistible feeling like you have to sit down. Like as soon as you get up, you start moving, the pain starts coming back, and you're looking for your next seat.
Exactly.
Yeah.
If people go to parking lot, they grab the cart right away and walk the cart all the way through the store, whether it be Costco's or ShopRite. Unfortunately, for S1, I've only seen about 2 people who have a spinal process at S1. It's usually not there. It's usually not formed that way. So L5 S1 is a level that we cannot do. L4 5 we can do. But on rare occasions, I've seen L5 S1 done, but it's maybe very rare.
Yeah.
And there comes someone calling me for who knows what reason.
Oh, is that you?
Yeah, take it out, turn it off.
Okay. Oh, yeah. So, we we got a lot of people interested, but yeah, no. So, just so we can catch everybody up, Dr. Gregory Flynn has joined the Jasper Spine Institute. He's one of us now, and we're doing shows together, whether Dr. Jasper's here or not, so you can feel comfortable with this amazing new doctor we have.
So thank you very much for the question, Big. That's a very good question.
Yeah.
And I wish we could have more people with the S1 area because it's a very problematic area, but unfortunately, it doesn't happen just yet.
Yeah.
So,
but like every day, there's innovations happening, and so Big D, you may not have to wait for too long.
Yeah, who knows? I mean, like I said, I actually retired once, and I was retired from 2020 to 24. And I was talking to Dr. Jasper, and I said, he said to me what he's doing. I said, that's amazing. I said, I thought all the patients I treated where I left off, what my knowledge base was, what existed at the time as far as the knowledge base 4 years ago, what the knowledge base is now, it's totally different. I mean, there's so many things we can do for patients that it's just amazing.
Well, you jumped out and then jumped back in right at the right times, like right at the start of COVID. Boom, I'm retiring. COVID's over. Let me see what's going on.
I know. And I remember taking my first trip going skiing and going to ski resorts at Steamboat Springs, and there's a line on the floor for where you walk with COVID.
Yeah.
The guy goes, follow the line. I says, I'm the only one here. Why am I not going to the bathroom right there? Why do I have to walk around the building? The
That was
rules were ridiculous.
mental. That was
Yeah,
mental.
yeah.
It was all the things that Anthony Fauci said he didn't say. He made it happen anyway.
Oh my gosh!
Yeah.
Don't get me started, Anthony Fauci. Let me say this: I'm a firm believer in what RFK's book wrote about the real Anthony Fauci. I read the book, and
Me too.
unfortunately, truth in medicine. It's something where, and I was taught, you're taught to question, ask questions, figure out what's going on, what the problem is, and just don't accept someone's devout, pragmatic answer. That's the way it's always been done. That's BS. We don't follow that rules.
Mm.
And in Florida, where I was from at the time, in the free state of Florida, it was much different. We had Super Bowl parades after the Bucks won the Super Bowl for the second time with Tom Brady. I think it was 56 cases of people who got COVID. It was probably less than normal average just for getting together.
Yeah.
But thousands of people in the streets partying. So I don't know. That's a whole different topic.
Yeah. Yeah. I remember the stupendous New Year's in Times Square that they had where it was just like hula hoops on the ground where people could stand in.
Yeah,
And there's like 8 people there.
That's pretty crazy.
Like we're gonna forget all this stuff, man. And it was a very unique time in our lives.
Well, I remember drinking a beer at a pub, and I think I was in Winter Park, Florida, Winter Park, Colorado, talking to a young ER doctor that works in Georgia. I said, "How do you treat these people?" He goes, "Oh, they come in waves. What do you do? We've been in the hospital, they die. Next wave comes in, they die. Next wave comes in, they die." I said, "How do you treat them?" We just admit them. I said, "You don't give them anything in the ER? Not even steroids, not even antibiotics, nothing.
Yeah.
They don't have to give us. The goal was to get him intubated, make another $40,000 intubation.
That's messed up.
I mean,
yeah.
When it comes out coming forth, it's crazy. People realize what happened to our country and how we were misled, and
and it's going to be coming out. I mean,
yeah. I did see where Kash Patel got this appointment. Back when HIV came out, as a work as ER doctor, we were scared about HIV. We were really scared about it, and then we realized that they made it a social disease. Well, it's not a social disease. No human disease is truly just a social disease. It's a bloodborne disease, airborne disease. It's fecal transmitted, urine transmitted, any kind of body fluid transmitted.
Yeah.
And they made it social. So they didn't pay attention to what was happening to the blood banks. For 5 years, the blood banks weren't checked. And it spread across the whole population.
Oh my God, yeah.
And that was a Dr. Fauci special.
Yeah. Well, we got explosions in autism.
Oh yeah.
Due to vaccines from
1 in 34 versus like 1 in 10,000 or something.
Peanut. When I was a kid, right, there was no kid who had a peanut allergy. No. There was a kid down the street who had ringworm, and we all talked about him, right? But there was nothing. There was nothing like that. Peanut allergies.
And it's funny to say ringworm because the drugs that be repurposed are mainly drugs for antiparasitics. That's what antihelminths, which are ones for worms. It's like ivermectin, fenbendazole. And the studies come out on that are just absolutely off the charts because it's called epidemiological studies, meaning like they study populations, someone has cancer, see what they're doing, where they're living, what the environment's like, what's happening. And finding people who live in those countries where those drugs are all in the shelves. Go to the store and buy some, the doctor's prescription. Everybody has ringworms and filariasis, riverworm, different things that affect humans. They take the medications. They weren't getting sick. I mean, they found out for COVID, those third world nations did much better than we did. Yeah. I mean, it's just.
But they were also allowed to talk about it and question it.
I know.
And all of that. Like we weren't allowed to say anything. And we got silenced if we did. We got blocked on YouTube, blocked on Facebook, block, just because we're what's going on.
Well, before I retired, being part of the frontline COVID care coalition doctors and that line of thought, I offered all my patients the medications they prescribed before I retired. So if you need some of these here, I'll get them for you. And that time it was easy to come by. I wasn't overcharging and stuff. And I did as a service to my patients. And then from there, for family members, and I treated quite a few family members with it. One in particular, my wife's uncle was in the ER, PO2, which is oxygen saturation around 70, 74. I just said, get him out of there. Get him out. And I bombarded him with steroids, ivermectin, hydroxychloroquine.
Yeah, but that was all the
Doxycycline.
stuff we were saying on. I have another show, and it's more political, and we were saying that through the heart of it. You weren't allowed to say it, man. And then all of those monoclonal antibodies
Right.
that Biden kind of collected them all together and said, like, no, you can't have them. Like, why?
Florida couldn't get any because we're
Yeah.
we're a red state. It was funny.
Oh yeah, that
Well,
was
you
mental.
laugh about it now, but it was really serious back at the time.
Yeah,
And
yeah,
in my
yeah.
practice, like 'cause I like Dr. Jasper, I had the ASC, Ambulatory Surgery Center, an office base, so I could take supplies from all the valuable supplies
Mm.
from there and have it for my patients come in and see them with full gowns, if maybe 2 weeks or full mask, glove, and gowns. This is ridiculous.
Yeah.
I mean, 'cause it wasn't that bad for us. And I had it's funny. I had a patient ran out of the N95 mask, and when my patient says, "Oh, my brother-in-law, he works doing abatement for asbestos. He's got tons of those things." So he brought me a carton of masks for my staff and employees and things. But yeah, it was different times.
It was different
Hopefully never see
times.
those times again.
Oh man, yeah.
Transparency, transparency, transparency.
Well,
So
RFK Jr. has a job. He critically bashed Anthony Fauci for having. So I think we're all a damn sight better. Connie Beck, she asks, "Is Dr. Jasper all right?" Yeah, he's great, Connie. He just texted me during the show there to tell me he was just chilling and relaxing today. So, and he needs it. He's been working off his feet.
thanks for asking.
Yeah, thanks
Now,
for
now he
asking.
knows
Hon.
you asked. That's good. That's good.
Yeah, now we have our phone lines are open. If you want to ask Dr. Flynn a question about your pain, it's 732-237-4949. That's 732-237-4949. Okay.
You're talking about patients. I started my practice in pain medicine in 1988 in Sarasota, Florida. Then moved to Tampa in 92. I had some patients come from Frostproof, Florida, about an hour and a half, almost 2 hours away to see me. This one gentleman that was coming to see me, and then from him, I got 30 patients from his hometown in Frostproof that came by and saw him. He just drove the 2 hours to see me as the doctor to treat him. It's amazing. They're also nice patients, elderly people who needed issues to be taken care of. And one of them in particular they talked about in the show, who was going to have a major spine revision surgery. I mean, he was an older man, he was 85. Spine would look like crooked as it could be. And it was very stenotic, very tight. And I said, we got this new device. This time it wasn't Minuteman, it was something else. And I put two of them in the gentleman. And it was interesting. He was so nervous about having anything done. They threw up as he laid on the operating table just from the nerves. I said, listen, Bob, can't knock you out because your stomach is still probably full. So
Right.
I'll do a little straight locals. Okay, doc, I trust you. I trust you. And we did it. And he got up off the table after we did it, walked from the recovery, was crying. I said, what's the matter? He goes, I can't believe it. I'm walking straight. I don't have the pain down my legs. I feel relieved. And I'm waiting to talk about it. I said, good news. Spread the word.
Right, right.
So we like the word of mouth spreading for our advertisements. The best way to go. Though we like talk on the show as well, but word of mouth advertising can't beat that.
Yeah, our girl Connie says, sounds good. He deserves a break. Yeah, he does.
Oh gosh, yeah.
Old Doc, man. He deserves a break. He's got all these hobbies and all these things. He's just chomping at the bit to go do. He just had a shoulder surgery that took him away from operating for a small bit and just having his fun on his free days. So he needs a day just to relax and get his feet up and just kip up.
I'll be the relief hitter.
Yeah, the relief hitter. But we got a great relief hitter, guys. Yeah. Now, I'm curious. Oh wait, we got another text here. This is from Big D. We couldn't get ivermectin for C19, COVID-19. So did horse-based wife better in ours? Yeah, because ivermectin was a horse medicine, wasn't it?
No, not really. It was used for horse, used for animals, but it's designed for humans. It's one of the most prescribed medications around the world of any med. And it's got a great safety factor. But the thing is, it's way out of date for its what they call it, something's trademarked.
Yeah.
So no one wants to research it because there's no money in it.
Right.
That's the greed of our politics of medicine. But that's 7-8 hours is what I've experienced. Most people got better with 7-8 hours. we started to turn the corner right away.
Yeah.
And it's pretty amazing. You know, I had a colleague who had long-term COVID, and he was very, very depressed. And I finally, after convincing him and his wife, I said, try this medication. And he had a friend who was a psychiatrist who was taking care of him. I talked to a friend. I said, well, you know, you're treating him for depression, but I think the source is the COVID. Take care of the COVID to go away. And I said, you know, he came in the ER and in the hospital with a low sodium. And the COVID virus goes through your nasal membranes to the back of your brain. That's where pituitary and hypothalamus are located. And that controls your salt in your body. So it's one of the sources is try and trace the source down. And he did it and did very well. Came right back around.
Mm.
But, you know, I tell patients that have COVID, I said, besides all the medications, just do a saline nose wash. Just reduce the amount of virus in your nose. Just do a saline nose wash, like the neti pot. It's very simple, easy to do, and it works great. And they did well. I mean, I had some average turnaround time for patients for a treatment COVID was 8 hours to 12 hours.
Mm. Well, that's why they were, when they tested you, it was like brain surgery, shoving those things up your nose. I went like once, and the irony didn't escape me, realizing that it was a Chinese woman that was performing this test on me, right? And it was like brain surgery. She was, I didn't even know anything could go up that far. That's how bad, you know. And that's just me easily, like, but meanwhile other people were dying around there. But yeah, what a bullshit time that was.
Yeah, I went from 2020 to 2024. I finally got COVID last July.
Did you really?
Yeah, my wife and her mother were at some farm up in Brevard, North Carolina, on this big hayride thing, and I was with the dogs doing some other stuff. And they got COVID, got sick, and then they were going to the airport, taking her home. And that day I got sick. And that's about 5 days. Got through the medication for it and everything. I was just tired. Just the dogs loved me being tired, laying in bed with them. It was fine. They loved that. So
I got it once the entire time, and it was like a really bad flu.
Well, saying now the flu deaths now are really up there in our country.
You know? Yeah, there's something going around. I think we've all had it a little bit.
I'm making a big deal about it, but you know, simple things: wash your hands, drink glasses, don't use the same glass, same straw. Just take it. You know, simple precautions.
Yeah.
But none of the 6 feet, this imaginary 6 feet apart.
Oh my God!
I finally said, "Well, I just made it up."
That's like that only worked, and this is how stupid, and they know how stupid the populace is. That if you they believe that germs don't move.
Yeah,
they don't travel. They're just right there. You have to actually rub up against somebody to actually get sick. You know, but like I was saying to everybody, we were outside at some it was like one of the first times we're getting out, so we're in somebody's backyard. As long as we stay outside, it should be all right. We're all still wearing masks, and like you know the air's coming out through the sides and stuff. These masks are bullshit. And I'm like, I'm saying to everybody, like, and then there's the ones that have it underneath their nose, and it's, you want to
chin bras.
Yeah, I mean, they were bullshit to begin with, but if let's not be douches about it. But cover your nose at least. But but I'm saying, like, if we coughed without the masks on, and there was a gust of wind,
it's gone.
It's taking it to maybe next door, or maybe 2 doors down, and somebody takes a big lungful.
Yes,
you know, it was just stupid. And the masks, I mean, the bugs were so small they could go right through the masks, and it was like nothing. You know, but we ate it up because it made sense. Masks, okay. You know. Anyway, what I'm interested in. All right, now we've heard from Dr. Jasper about how he first discovered pain medicine because he was an anesthesiologist to begin with. I'd like to know what your self-discovery was with that kind of field.
When I trained at the University of South Florida, Tampa General, we had a doctor from Louisville, Lexington, Kentucky, who was our chairman down there, and he was very skilled at things outside of anesthesia, such as bronchoscopy, nerve blocks, and he had us all trained on doing nerve blocks. And then in the Navy, we ran our clinics for rectal surgery for a variety of things, hemorrhoids and pilonidal cysts. We learned nerve blocks through the caudal canal. That's the tailbone and base of the spine. help treat the patient. So I was amazed that worked. And I watched anesthesiologists a lot, though I didn't do anesthesia training in undergrad in med school. So those two experiences there. And then when I was finding anesthesiologists, I was watching an orthopedic surgeon put in a pain pump. For him, it was a pain in the butt. He didn't want to do it. He goes, "You should do this, Greg." And every time he called me to do his case, "You should do this, Greg. You should do this, Greg." So I said, "Fine, let me show him how to do it." So he knew I did ear medicine. He knew I knew how to suture. And so when I got the surgical internship, and so I just started doing it. And I was working at a hospital that had no regs on it, and the surgeons were too busy to put in pain pumps or put in stimulators. And I did a few pain pumps, but they weren't that rewarding. But the spinal cord stimulators were very rewarding. And I did the blocks along with it. It's just a little pain clinic in the hospital. And I started rolling my practice from anesthesia into pain medicine. Eventually went full-time pain medicine in about 94. And I realized that it was something I needed to do because I just liked the patient care, the ongoing doctor-patient relationship.
Yeah.
I really, that attracted me the most to doing the procedure. And plus you're doing procedures, you're using your hands. So it's nice. You're not sitting on your duff. You're always walking around doing something, doing procedures. Where if you're in the OR doing anesthesia, for example, I did my colleague's mother's brain tumor was a 17-hour surgery from an angioma in the brain. And the anesthesiologist was there for 17 hours doing this case. It's
a lot.
It's a lot of time. A lot of sitting around. You always got to be on your A game. You always be very vigilant at what you're doing. Make sure you take care of the patient. Make sure you follow everything. Make sure you follow what the surgeon's doing. But it's monotonous.
Yeah.
So our procedures in interventional pain medicine.
So you felt like you needed to do more.
Yeah, I did
for the patients.
Yeah, I just felt that if you do a great job in anesthesia, the best job ever, the patient doesn't remember you. That's who did a great job. They don't remember you. They don't want to wait. They're not feeling pain. But the rewards aren't the same. They just kind of blow you up. Oh, whatever. You did whatever.
Yeah.
And I kind of, when I trained at Cleveland Clinic, we did all the ICU work ourselves. So when I got this private practice, I remember doing a patient it's called aortic aneurysm that ruptured. She ruptured a previous repair graft. So the second time we redo it's really a mess. She's in her 80s. And I did the anesthesia for her. And then I followed the ICU for the next 2 days. And she got better. And the surgeon never got a call, took everything for him. And she appreciated it. The surgeon didn't appreciate it because he just felt that, I shouldn't have charged for my time in the ICU care. They were very narrow-minded about that. But I realized that I really liked the fact the patient knew me, appreciated it, knew what I had done, and gave me a fulfillment that I didn't otherwise get. Just knocking someone out, waking them up 10 minutes later, an hour later, 2 hours later, then you don't know who you are. So I missed that acknowledgement by patients.
Because that's the beyond the paycheck. That's what keeps you going.
Yeah, it's what's in your heart. It's what's in your heart. Yeah, you want that, you like that. And I see that like in Dr. Jasper's office. I see it all the time from all the staff the same way. They have the patients in their heart and they really take care of the patients and really feel for the patients, and the patients, identify that.
Yeah, we see them come in at their worst, no color. They think this is it. They're going to live forever with this pain. I actually had a surgeon tell me there's nothing that's going to happen for you.
Right.
You're going to have to live with this for the rest of your life. Pain 24/7, And I was like, oh my God. So I had gotten to dark times when I was by myself before I found Dr. Jasper, who on the first visit said, I can fix you, and you roll your eyes and you're like, I've been to every fucking doctor. Yeah, I know. I get it. How long is the wait in your waiting room? That's all I care about because it's a nightmare to me, and on the fourth visit, he changed my life. And that's the good thing. That's the reward, though. You see the patients come in with no hope, and then you give it to them, and that's like changes.
We talked last week about the fact that what you and I both look forward to, the thing called Viadisc, where actually take a disc like this here, and you put the disc is shrunken down because it's collapses. Also, it's fluid inside of it. You put a needle inside where the nucleus used to be the disc, inject nucleus material, which comes from the cadavers. And over time, 3 to 6 months, it grows and elevates the disc, which then elevates the space between the bones, which frees your nerves up, and you feel great. And it's so simple to do, and it's such a great thing that didn't exist in 2020, exists now. So that's like, I keep thinking of all the things that I could have done for patients back then that I can now do. It makes me feel kind of sad.
But that's a major hit against degenerative disc disease.
Oh, it's just it's mind blower. It breaks what whoever thought that was just total genius.
Right.
Like Elon Musk type genius,
Yeah. It's one of those ideas you wish you had yourself. you know. Um,
And then the other one we talked about was that as the bones get really degenerative and start to compress, the nerve inside there gets very irritated and causes pain. It's called vertebrogenic pain. That's kind of the pain that never goes away. With sitting, standing, laying down, you always have that pain. You can now go in there, put a probe, and kill the nerves with electroradiofrequency energy, heats the nerves up, and the pain goes away. So that's another thing that we didn't have 5 years ago that we have nowadays.
yeah. Let me see here. Is a TENS unit good to use for back pain and build up muscles in the back?
Yes, that question is yes. If you put a TENS unit on and it gives you relief, then hey, keep using it. That's worthwhile.
Yeah, yeah, yeah.
And also, include stretching, drink a lot of water so you're not too dehydrated. As far as building muscles up your back, they've looked at a study, especially people who have like paralysis and things, and it can work to some degree, but the nerves not going to the muscles is the big key for a lot of those patients. But if you find it works for you, great. But you're only working with a few muscles at a time. What you really want to do to strengthen your back up, you want to do your core muscle group, which means you're going to work the muscle at the back of your spine, and that's doing the prone position
Mhm.
with your leg on your tiptoes, your elbows in front of you, and keep your back straight and hold that position for as long as you can. Ideally, 30 seconds at a time, get to 2 minutes, be great. And then the other side, you can lay what's called dead bug, which is basically lay on your back, raise your feet up, your arms up, and lower them down one at a time in opposite directions. That help build your core, which is your core muscles, your transverse abdominis muscles, your abdomen. And then things just like walking, doing squats in place, exercise in place. All those things will work your core muscle group, which help you back strong.
Yeah. But that's like you're not going to have like a pill or a procedure or
No.
or a
And then,
device that's going to make it all happen for you.
and then yoga.
Yeah.
I tell a lot of patients, hooked on this yoga instructor on YouTube called Yoga by Adrienne, Adrienne. Real nice. I don't know how old she is now. I've done it for like decades with her. But her classes are great. And each class is designed for muscle groups. You see, you work your hip openers. You want to work on your back. You want to work on your quads, your muscles in your back, your spine.
Yeah.
You exercise each one of those. That's 10, 15, 20 minutes. Or you can do a whole yoga session. It goes 30 days, an hour session at a time. There's a wide variety. And you pick and choose what you want to do in the pleasure of your own home. That's really nice.
Yeah. Yeah. Um now with the degenerative disc disease, yeah, I was told um that was it. You have that. And it's gonna it's gonna make thing, even if you have the like an endoscopic discectomy that helps you out and stuff, you're still in danger of reherniating or anything's possible with
Right.
that. And when I learned that you could be bearing down on the toilet, or you can be bending down to tie your shoes, and you can herniate. It's very simple, but with the minimal invasive procedures that we do, um, Dr. Flynn, Dr. Jasper, they'll see the simplest solutions are a result if they come out good, right?
Right. Right.
So if you get like you roll off the table, you feel good after a shot, you know and a lot of people don't understand the shots because they can get them anywhere, but they don't always work everywhere else.
Right.
So we have quality injections that we're putting into you, okay, and we're also x-ray guided, so we can get the needle right where it needs to be. A lot of this is guesswork where they just put a dot and stab.
Yeah, those days are gone by, thank God.
Yeah, but there's
You know,
still a lot of doctors out there, though,
that's,
man.
that's a crying shame. That should
Yeah.
I will say, Dr. Jasper Spine Institute, we've got some great X-ray techs that we work with, and Dr. Jasper is a great teacher. So they are experts at targeting, both from the X-ray fluoroscopy version, and Dr. Jasper is an expert at targeting, and I've become an expert at targeting. Um, and it's just this practice. You do it so often, so many times, so many different types of patients, whether they be skinny, fat,
Mm.
straight spine, crooked spine, spines osteoporotic. You can't really see the bones. You just get good at it after doing it so often. And like Dr. Jasper always says, it's always the minimally invasive thing we do. If that makes you better, then we stop there. When you get worse, you come back, see us, we'll do more. A lot of times, there's so many things we can tell a patient that they may need by the look at the MRI scan, but in reality, the MRI scan is not the patient. The patient has so many things going on, but maybe one thing's causing problem. treat that one thing and they get better. It may just be like a bulging disc at L4 nerve root, maybe the
Yeah.
problem. Or we have a horrible back and look at it, they had a compression fracture at T12. Treat that, they feel better. And the
Mhm.
pain, other pain may reappear later on because the worst pain is overshadowing everything else, goes away. But we just tell them, come back, be patient, come back. We're not going to bombard you with a major surgery that takes away your spine 5 levels. The big problem with that is that even me with my minimal spine surgery I had tremendous scar tissue. And I was still having pain after surgery. So I went and got an MRI scan done by a colleague of mine, had a block done. And I had scar tissue for 2 levels below and a level above where I was operated on. The scar just kept growing. And finally it stopped, but medication helped stop growing. But
Yeah.
it was painful. And I thought the surgery wasn't a success, but it was a success, just that the scarring was setting in like week 3, week 4, and
It does grow back.
yeah,
Yeah.
yeah.
It fills
You
in. That's what just happened to me recently. Like maybe 5 months ago. I woke up and I discovered my left foot doesn't want to move. Like it didn't move at all. Um, and it was full on drop foot. There was no pain at all.
Mm.
And so, like when I woke up in the morning, like yesterday was fine. I woke up in the morning, it doesn't work, and I thought it fell asleep, or maybe I was laying on it wrong. Then I'm getting up, and it's like dragging underneath me and threatening to
Oh my
trip
gosh.
me. So I came in. Um, the nurses were like shocked that because wait, you don't have pain? And I'm
That's
like,
unusual, not that any pain. That's
yeah. Well, what it turned out was that everywhere I had work done filled up with that scar tissue, and it was packed. It was really packed in. I had to get 2 procedures to get it all cleared out, and I honestly, between the two, I thought, all right, I'm going to be living with I'll either have a walker or a cane. Hopefully, a cane, not a walker.
right.
But you got your mind's got to go through that. And I even said to Dr. Jasper, I said, listen, I understand, like if this doesn't help, I don't want you to take this to heart because I know he would. I understand that you've done everything for me, and eventually, because my back is just how it is. It's you have back problems, and you're going to have them your whole life, whether they fix you or not. You just have to be careful with yourself, learn how to re-walk, re-sit down. I used to launch myself into a chair and whoosh,
Out of chair.
like teleport right out of it. And but you gotta be very careful, and I even though I'm careful, sometimes it's not enough. That scar tissue will just grow and it fills in those spaces. So when your nerves weren't being pressed against by anything, the scar tissue is now pushing it up and pressing it
Right,
against
right.
and if you've got like bone spurs or anything like that and it's shoving it into them, yeah, it's gonna kink
Right,
things off,
right. And the human body, the degenerative process of our bodies as we get older, of course, we're impacted by gravity, which pulls us down. And I always joke with patients, if you want to get really, really well, get on SpaceX, get out of space, and you feel great while you're zero gravity. But you come back home, you'll be feeling the pain again. So it's a lot of challenge for us to try and treat the patient, find out what's causing most of the pain, how to deal with it. And like your case, like my case, I had my back surgery so much my disc blew out that I almost had no disc left, so it became bone and bone right away, which then brought
yeah.
on motor changes, which are changes in the vertebral body. They're inflammatory. They irritate that nerve we talked about earlier, the vertebral basal nerve. And if you can block the nerve, you can get that pain to go away. But I think the Viadis one, injecting new disc material inside of disc is the best way to go.
Yeah, that's magic.
Yes, it's magic.
Yeah.
And other things happens when your disc collapses, your vertebrae may not line up straight. They may be rather than top one another, they may be shifted off anterior, posterior, causing issues. It causes where the nerves exit the canal to be narrowed down and pinch the nerves. So it's things you have to do. And in my case, I was lucky. Mine shifted off to 13 millimeters, pretty far. Then it somehow, maybe I fell snowboarding, who knows, shifted back to like 6 or 7 and was solid. So it was solid there. So I could get my surgery done by Dr. Jasper and get the spacers in.
Hmm.
So I was lucky. But, we find most patients that if we keep whittling away at the problem, the issues, and do things one at a time, and those who are patient stick with us get better. Those who want like an instant miracle, nothing's going to help them. And unfortunately, a lot of those people just jump to the knife and get surgery, open surgery. Now they're stuck with that for life. And it's sad. You see someone who once had an open canal from the surgery. 3 years later, now it's very stenotic, which means very narrowed down, very tight. So nerves are being pressed upon, and that pain's hard to get rid of.
Yeah.
It's a
Yeah.
challenge.
Good morning, Eileen. How you doing? Eileen's one of our usuals.
Yeah, Eileen, how are you? Nice to hear from you.
Yeah. So what other procedures are we looking at now? Everything's changing. Like every Wednesday I come in, there's either like a new doctor or there's a new procedure we're looking into.
Well, the big thing is like I'll use my example. So you have the Minuteman procedure, but before you go to that procedure, you do a steroid injection first to identify that is the correct level. So that's a transforaminal epidural steroid injection. Maybe both sides, one side, maybe more than one level. But you want to make sure you got the right level. And then if you find someone's ligaments in the back of their spine are hypertrophy, that's what we talk about the scenario of a belt, where someone takes a belt and they snap together. It's very taut. So the space beneath the belt is very large. When you push it together, the loops go down and impinge upon that space, the space being your nerves, your nerve roots. So we can now go in there with a thing called the mild procedure and actually go in there and dig away the material.
You remove a piece of the ligamentum flavum, so where it would normally loop out and press against the nerve down the central canal, it won't anymore.
Exactly.
You can't.
Exactly.
Yeah.
Exactly.
And
And
I don't know.
I know you've been this a long time. I'm just a newbie on the block, so what am I explaining to you for? You probably do it by now.
Yeah.
But anyway, so that we can get the central part of the canal and some of the sides of the canal opened up.
Yeah.
If that works for you, that's all you need. Your pain's gone away. Stop there.
Yeah.
In my case, I had it done in January of 22, and because I was going snowboarding, so I couldn't put the other device in because I couldn't do it and go snowboarding. And I snowboarded all season, so it came back in April of that year. And that time I could barely walk. So it was a struggle walking.
Yeah.
And I had the
sometimes you're a slave to your hobbies, man.
I know. You gotta live life. You gotta live large.
You do.
I mean,
you do.
Can't sit down and do nothing. So I had that done. And it took about 3 months to get solidly in place. I went mountain biking, it's another thing I do. And all the things you shouldn't do, I do probably, just not supposed to. But that's what Dr. Jasper, he has the same heart. He has the idea that you live life large and do it. And, you keep living. So, I mean, I'm here now with Dr. Jasper working all the time after work every day.
Yeah.
Shed a few pounds and my body feels great. I don't even take Tylenol or aspirin now.
Yeah.
I feel, but now I'm a slave to the gym because I feel now when I do this 50 flights of stairs, 100 flights of stairs on a stair climber, I'm exhausted. But an hour later, I feel just phenomenal. Feel this big endorphin surge.
Yeah. We got Eileen. She says she feels great and she's pain free. Look at that. Huh? Look, that's great. That's great, Eileen. I'm so happy for you. Then we got Chris Cullen, always listening and learning, and huge thanks to the Jasper Spine Institute and Dr. Gabriele Jasper and Dr. Flynn. It's actually
Flynn, F-L-Y-N-N.
Yeah. And Jeremy. Hey, what's up, Chris? Yeah. Didn't I just see you in the office recently, Chris? Or so? No, we were on the phone. That was it. Was it.
3 injections in 3 years. That's nothing. That's wonderful.
He's had 3 injections in over 3 years.
He's doing great.
The best life due to you all. Thank you is not enough. Owing you my best life at 70 years old. Dude, Chris, live it up.
And Chris, that's what we live for. We live for people who give us those compliments.
Yeah.
We are slaves to getting comments.
We love Don't think we don't love them, guys. No. We love them. A lot of you are quiet out there who watch us. But we love it.
Tell your doctor. It's a compliment, doctor. Doctors need some praise now and then.
Yeah. Because sometimes it's just you get beat up on. People come in with negative afflex. Their pain is causing it. We understand that. But yeah, it's just say thanks. Hey, or I feel great. Just saying you feel great is a compliment to us.
Bring up things. So
yeah,
I was in the office last week, and a patient came in, and they had severe hip pain, and but they also had problems with the back, problems with their spine, problems with stenosis, problems with arthritis.
Right.
And so we said, well, obviously the easiest thing to do is inject your hip. Injected the hip, sat in the waiting room, pain went away. Any other pain? No other pain. So everything we saw in the MRI scan, it's still there.
Right.
But it wasn't the source of pain. So within like 10 minutes of being there, she got an injection hip and she was out the door. We done an ultrasound, so it's really easy to know where we're going. He's out the door feeling better. It's like that's a success story.
Yeah.
I mean, it's not a big breadwinner for the doctors, but who cares? It's all about getting you better. So, you get better that day, you tell 10 more patients come and see us. If it was all 10 hip injections, who cares?
Yeah.
We want you to be better. We want you to feel better, get better, and praise us. We like that.
Well, here's Eileen. She says, when I first met Dr. Jasper 2 years ago, I was in so much pain. I went along with his plan for me, and it takes time, but stick with it. Yeah, that's what I say to all of the patients that come in. If I'm walking through the waiting room, I'm on TV, so I'll talking about my case, and a lot of people that come in is because they saw my commercial and heard me talking about it. So they always want to stop me and say, "Hey, hey," and I always sit down with them and tell them everything, But I always say, it's a process, it's a road. You got to stick with the driver, all right? Because you came to a place where the driver knows where he's going, and just stick with it. So yeah, Eileen, 100%.
I mean,
100%.
you telling us that here, telling other patients who are listening to us, that's great. If you can tell people in public or in the waiting room, that's great. I used to love patients in my waiting room complimenting me to other patients saying, "We know he's behind schedule. He talks a lot, yada yada, but just bear with it. You get your time, and he'll spend time with you. Don't worry about
Yeah.
that."
Compared to other places,
Oh yeah,
compared to other places, there's no, you're in and you see the doctor for maybe 2 seconds. You're lucky if he remembers your name without looking at the file. Dr. Jasper's not good with names, but he's great with faces.
So am I. I'm the same way.
Yeah,
I'm the
so
exact same way.
that's why we take pictures of our new patients, and when we put your picture in the back of our file. So when we're trying to when we're doing our, hey, this is who you're about to see part of the day, um, the first thing you're shown is a picture of the patient, so
Right.
you know who they are.
Right.
Yeah, that's really great.
And the patient aspect of being a patient is very critical because things don't happen overnight, and we don't want to do too much. We don't want to bombard you with so many things, like all the things we could do for you, because you'll forget it. And I used to sometimes encourage patients, if you want to record this conversation, please do share it with the family.
Yeah.
One lady, it took me a while to get her to understand the idea of treating her spine stenosis with decompression. So I'm on the phone with her and her son, who's in the military in Alaska, having the conversations. She's my favorite patient. She still calls me every 6 months, says, "How you doing?" Just checks up with me, how I'm doing.
That's great.
She's probably mid-80s now, but she was wonderful.
That's great. Yeah. So, all right. So, wait, I just blanked out on that. Yeah. Let's bring it back to you.
Talking about patients who appreciate things and patients being educated. It takes a while, and we know so much. To us, it's like secondhand. But the patients come in the door learning about what is spinal stenosis, what is facet arthritis, what is, lumbar radiculopathy, what is radiculitis, all those things. They're new words to them. So we have to make sure that we, like I'm doing now, talk slower, be more understandable, and acknowledge that they don't know it and repeat yourself. And then we have staff that's the same thing as well. But it's very critical they understand what we're going to do, and we don't overflow them with information because there's so much that we can tell them about. But that's confusing. So that's why you pick the first problem, like the hip injection. If that makes the pain go away, yes, you've got these other issues. If they become important to you because you're now having pain from those issues, we'll address it at that time. But right now, your hip pain's going away. That master SI joint pain, your sacral joint pain, let's just don't worry about it.
Well, here's a good example. When I first came to Jasper Spine Institute, I had 2 herniations. One was huge, okay, and and the other one was very small. Once the big one was taken care of, I felt like $1 million, like I was fixed. And doc says, "You have a tiny little thing here, but it doesn't look like it's doing anything." And then later, and I'm talking a couple of years later, it that one herniated even more. All right. And it was only then, but that first procedure brought me several years of feeling great. So sometimes you don't have to, it's not like they're taking an eraser and erasing everything wrong with your body. A lot of people come in and they got all these aggravations from other doctors they've gone to who've done nothing for them. Because when you're especially if you're a new patient, you come into a place and you see maybe the waiting room's filled and your eyes start to roll and like, oh, this is just going to be another waste of time. But like Dr. Flynn was getting to, it's it's good to know you have these professionals who are going to take time and speak with their patients. Like, so when I came in, and all these big words like radiculopathy and transforaminal surgery and all of that jazz, man, especially when I started marketing this stuff, if you don't have a head for that thing, that kind of thing, you're going to be left behind. Like, so yeah, if you're just patient and you listen to your doctor, that's something that cannot be said more, is listen to your doctors,
Right.
because
Very,
and
very
it's
true.
important for you to understand what's wrong with you, and the possibilities that can be done to help you. Yeah.
Yeah, a lot of what we learn about the patient is from taking a good detailed history, and our staff does a great job of doing that. We need to ask the questions like many times the patients say, when is your pain the worst? They'll say, well, I get up in the morning, get out of bed, and severe pain, and then it doesn't go on my legs or anything, but stays on my back. I start exercising a little bit, it gets better as the day goes on. Then in the day, it gets worse again. Yeah, it's probably arthritic pain in the back of your spine. If your pain's shooting down your leg, well, it's probably one of the nerve roots being impinged upon by something, whether it be a bone spur, whether it be a herniated disc, or something else causing a problem. Or if the pain is just when you get up and you stand up straight and it hurts unbearably, bend forward, get some relief, that's spondylosis pain. So, and it can be at more than one level. It's a lot of times you see patients with like 3 levels of severe spondylosis. Just no point in jumping there and putting 3 Minuteman in them to spread the space open, because just one may be causing the pain. And if you do the one and it goes away, then you're done, one and done. If you need to do more, you do more afterwards. But it's a stepwise process of identifying your history, how you're feeling, and for the patient also understands that once you take care of one pain, say example the person with the hip got better, but we know that they have arthritic and the arthritis in the back and have back pain later on. And they'll come back in a few months, say, "Well, my back's bothering me. Can we take care of that?" Or they may come back in 6 months, say, "Oh, my hip's bothering me again." Say, "Well, it's been 6 months. Okay, we can do another injection." Or you may want to see an orthopedic surgeon about getting hip surgery, hip replacement, depending upon how bad your hip is degenerative.
Yeah.
So many choices, many things to do, and that's what makes the practice fun. We're always doing something different. Each patient's different, and helping educate them. It takes each patient learns a different way. Some verbal, some audio, some by written words, some by seeing things on TV. So all those things that kind of help us to help you understand what we're trying to do for you.
Right. Right. So, all right, we got another message in the chat. We got Christopher. Yeah, Christopher Cullen. He says, "I not only got my sciatica fixed, but also my radiculopathy." Isn't that the same thing?
Okay, but yeah, pretty much.
Yeah.
Yes. Radiculopathy applies to any nerve root. Sciatica is like a specific nerve root, L3, 4,
Right.
lumbar area.
As well as no more tingling and numbness down my arms and both legs. That's great, Chris.
Well, that's great.
That's the best part right there.
Yeah.
Yeah. When you start getting numb and tingling, when you start like not being able to feel your toes or your
Your
uh,
fingers, your hands. Yeah.
pain starts going down from down your whole leg to the ankle, or and sometimes who knows where the nerves are going to be sending those pain receptors down. It's a bad that's a bad
That was
time.
bad. Yes, it's bad.
Yeah.
I mean, when I had my herniation surgery for my disc in 2000, I actually had herniated in 96. I had auto accident. Someone pulled in front of me going across a busy road, and I T-boned them in a Volvo wagon, which should be a very safe car, but I saw it happening. And I immediately braced for it. Hands were rigid, foot slammed on the brake, how hard they hit the car, bam. All the energy went through me, and so I got a herniated disc in my lower back, but it kind of sat like a cherry, like just a cherry.
So
sticking out.
rather than whiplash, you got herniated.
Yeah, yeah.
Wow.
Whiplash came in the accident in 2017 when someone rear-ended me coming off the expressway down by Annapolis. But anyway, that one there, I had a bulging disc, and I had back pain, caused issues for a few years. I gained weight, and also dealt with some other issues. But when I finally herniated, I was just taking off a cowboy boot. I was trying to cowboy boot on in Oklahoma with my girls at a horse show, and felt a searing pain, like someone had stuck with a hot poker down my sciatic nerve, down my leg, down my back. And that was on a Saturday. I couldn't hardly sleep that night. By Sunday, I couldn't go to the airport. I couldn't walk to the airport. I'd be in a wheelchair to go to the airport. Got to my office, called a surgeon friend of mine who says, "Yeah, I learned this new procedure, but I've only done 2. Why don't you go to the guy in Memphis, Tennessee, who taught the procedure?" So I had the new procedure done. That was the new endoscopic, so through a tube, so a tubular discectomy. He did that, and he got it all out.
Yeah,
For
that's
his,
your basic endoscopic
yeah,
discectomy,
from
right?
going back in
Yeah,
2000. Yeah, yeah,
yeah,
and it did a great job. But I already had foot drop because already been gone for like 36 hours, so I had foot drop, and it came back to about 85% over the next 3 years or so.
yeah.
But
We used to call it the endoscopic tubular retractor surgery.
yeah, exactly.
Yeah,
Yeah, yeah. But I can tell you that it's you have to be patient because even doing that and having had some scar tissue for me, having another block done. Once the other block was done, I was better. But it just takes patience and knowledge. And I went back to work at 6 days,
that's
seeing
brilliant.
patients in a wheelchair.
Yeah.
Just couldn't get
That's
around.
what you guys do,
Something,
right? You
yeah.
know, see, everybody always asks that question when you find yourself a doctor or they think about it. What happens when he's hurt? Who sees him? You know, like, and that's a tough thing. Like for Gabe, it's like that's the amazing thing. Who does he go to?
But now I can help him out.
Now you can help him out. Yeah,
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 yeah. That's what we talked about yesterday. So now I can pitch it for him. But
yeah,
yeah, it is a struggle, and you don't want to get sick. Your patients, I mean, if you had an office of 30 patients come to see you that day, I mean, they may travel 100 miles and 50 miles to come see you, and it's a lot to put them out, not be there, not be able to take care of them.
right.
I think in my years of practice, missing work for being sick maybe 3 times. Missing work because of a surgery or something. Because I had, from the second auto accident, I had shoulder surgery, carpal tunnel surgery, but I soft like do it on a Friday, back to work on Monday. It wasn't a
Yeah,
big deal. But it's getting old. It's being active, doing things. You're gonna have these things gonna occur to you. You gotta push through it and just move on.
yeah. I mean, I remember Doc had like a total hip,
Right, right.
and a few days later, he's got this whole rigging up so he can prop himself up and still do his
Right,
surgeries and stuff. But because his patient's pain trumps his own. That's
right,
how he
right.
feels. You know.
Exactly. I feel the same way. It's exactly what it should be.
Yeah.
And and the patients appreciate that. They really do. If they don't appreciate it, they shouldn't be your patient because Dr. Jasper puts his all for his patients. I
Yeah.
put my all for my patients. And it's how we are. It's just how our nature is. It's not all about the buck. It's about getting patients better and making us feel better. That's really critical to me.
Yeah. Yeah. No. You guys are special. We always used to call you guys like you super
Super
specialists.
specialists.
Super specialists, because dinosaurs disrespective. You
Well, but
know,
we are dinosaurs too.
you're kind of dinosaurs too, but we like to say super specialists because you're not like the kids coming out of school nowadays. You guys have seen everything, and that's the kind of doctor you want to go to. To a doctor who looks at you and what's going on with you and isn't surprised by it,
And
or as much.
when I finished med school, computers weren't even around yet. I mean, it started. I think the first Mac came around in like 79 or something, 80 when I finished school.
Yeah.
And then in medicine, we didn't. I remember doing things as an intern to determine someone's cardiac output using the thing called the thick equation. It would take a whole sheet of paper, do all the formulas on the thing to see what their output was. That was just inject it, push a button, it comes, it reads what it is.
Right,
It's
right,
totally
right.
different. So it was different times, different eras. We still question things that was going on, and I mean, I encourage young doctors who are out there now. It's just a question why things are what they are, and don't accept status quo. Never accept status quo.
Yeah.
Always put your patients
But
first.
there's still doctors out there that are they do that series of 3 shots and then send you to a physical therapist and then you're back for another series of 3 shots and then back. I got trapped in that vicious cycle at one point, and I was just like I wanted to just scream at everybody,
Right.
and that's the bad part of some of us patients when we do find the right doctor, we're so hard done by all the others that it's hard not to take it personally, and you don't know that.
It's a challenge.
Yeah, you don't know that there are doctors who aren't like that, and like you. And here's Eileen. She says to you, "We really appreciate you."
Thank you, Eileen. That
Yeah,
makes my morning. Thank you.
yeah, right. So that's all it takes is for a patient to see what these men do, and you know, uh, and it's life changing
Right.
for people. Yeah,
And Dr. Jasper is a great teacher. He is a great teacher. A lot of awards for his teaching. and encourages doctors who want to come learn from him to come learn from him. And we're also encouraging people to come use our facility and have our expertise, so they can see how we do things and work there with us,
Mhm.
bring our patients there, because you got great backup.
Yeah.
You got two surgeons who know what's going on, how things are done, Dr. Jasper especially, and you have backup. So if you want to come work at our facility, please do. I think he would encourage that.
Yeah, he does encourage it. In fact, we have a surgery center, the Jasper Ambulatory Surgery Center, and there's a lot of days in the week that it's empty, and there's a lot of space open for surgeons who want to bypass all the BS at a hospital, waiting all day long to do one case, because that's the pain in the butt of it all.
Oh, yeah.
Like the patient thinks they're waiting, the doctor's waiting too. I mean, he has no, you know, but at these surgery centers, doctors can come in, they can get their patients taken care of swiftly
Right,
in a
and,
clean environment, because our ambulatory surgical center is infection free. We've never had an infection rate in our surgery center ever.
my place too in Tampa, I had no infection rates for over 30 years.
Yeah,
But we do clean surgeries, and the staff keeps things clean.
yeah.
Our turnover time is quick. Like Gabe's probably 6-7 minutes. The best bomb is about the same, 7-10 minutes.
Yeah.
And in a hospital, it's 45 minutes sometimes.
Oh yeah, yeah.
And you never know what case is there before you. And some of the practices in hospitals, as far as keeping case cards in the OR rooms where other things are going on, I just never bought that line. But it's just a nice place to work, nice place to be. Patients like it. It's friendly, and it's, as you say, it's a very clean environment.
Yeah.
Very safe.
All right, we're at an hour. We got Christopher Cullen. He says, "Oh my God, dude! Like, if you don't walk away feeling good about this, I don't know what." He says, "You are God's. You are my church and congregation. Amen to you all at Jasper Spine Institute. Thank you, Lord above, for these doctors and procedures." Chris.
Well, Chris, let me say this: I am God's servant. I am not God.
Yeah, Jasper.
We are servants of God and serving His people. That's what we like to do.
Powers of God work through their hands.
Yes.
That's it. Yeah. So we're
good.
Gonna wrap up here. What do you think?
Sure.
Yeah, this was a great show. These, these first bunch that we're doing with Dr. Flynn is kind of like getting to know the man. Because meeting a new doctor can be intimidating, and we hope these shows show you that these are regular guys. When you strip it all down, that's what they are.
Well, I like the COVID conversation to start our show, because I had some strong thoughts about that. It shows who I am and what I think and believe about, and you put patients first. You do what's best for patients.
Yeah, well, you can talk about that stuff. You're free to. Okay. Yeah, we can talk about, and if it gets because you know what, politics and medicine have collided over the last bunch of years. So, talking about that and educating our patients about that kind of thing, I think that's important.
Well, the one I see, I turned them onto the website. It's called FLCCC.org, which stands for Frontline COVID Care Coalition.
Yeah.
There are some great YouTube videos there about different doctors speak about different topics. There's a Dr. Hazan who went to the University of Florida in gastroenterology and moved to Malibu, Hope practice, survived the fires. Great physician, really good researcher, and speaks well about what happened during COVID things. And she also wrote a book about her practice, and it's called "Let's Talk Shit." It's their book.
Stop, really?
Let's Talk Shit. And she is so funny, but she's just so hilarious and to the point. But I would check that website out, because learn more things about not just COVID, but new cancer treatments, old treatments being repurposed for cancer or drugs. And it's just very educational. And it's not mainstream yet, because mainstream was, in my opinion, far left stream,
right?
Being Fauci driven. But we're getting back to now doctors thinking for the patients and doing best for the patients. So it's good.
Yeah. So if you want to make an appointment with Dr. Gregory Flynn at the Jasper Spine Institute, please call 732-262-0700. And you're not going to hurt anybody's feelings. If you want to request Dr. Flynn, that would be great. Dr. Jasper would love that. And if you want more information about Dr. Jasper, Dr. Flynn, soon to come, go to Jasper MD.